Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. For those of you who know me, welcome back. For those of you that this is your first time seeing me live, seeing my videos on live, or catching it on the replay, thank you so much for taking time to spend with me and listen to what I have to say. For those of you who are sharing the videos and inviting your family and friends and colleagues to come and check out Wellness Wednesday with Dr. Wells, I appreciate you. And I just want to publicly say that. Thank you so much for all of your support. Thank you so much for the encouragement. Thank you so much for being here each and every Wednesday that I am live to discuss different health topics. My mission and our mission with Wells Legacy Health and Wellness is to ensure that our family, our friends, and our patients and community has the information that they need to be able to create a legacy of good health. And doing that starts by making one decision, picking up the phone and making an appointment if you have not had your physical exam within the last year, picking up the phone and scheduling the appointment for that recommended screening that your healthcare provider has been encouraging you to have for a couple of years. That means picking up the phone and making the appointment, or going online and making the appointment for the therapist to speak to someone about your mental health. As I've spoken many, many times on my lives, and many of you have heard me say this, that we look at the whole person, holistic care. And that means if one part of your body is not in sync or out of alignment, then it's going to impact the other parts of your body. That's spiritual, physical, emotionally, and mentally. And so we have to make sure that we are good all around. We at Wells Legacy Health and Wellness are here ready to partner with you on your healthcare journey. As I mentioned, we've had some exciting news. Each week, we're getting some additional healthcare insurances that we have been approved for to accept. And so if you want to find out if we are accepting your insurance, please reach out 321-306-6755. For those of you who don't have insurance and you're wanting to pay out of pocket, you can book your appointment online at wellslegacyhealth.com. If you have any questions or concerns about any of the things that I speak on tonight, or any things that related to health, and you just need to have a consultation with someone, reach out to us. It's free. Our consults are free. So we're here to partner with you on your healthcare journey. I hope that something that I say tonight will help you or someone else. If one thing that I say tonight helps one person, then I've done my job. Thank you so much for you who have supported me from the beginning. Those of you who recommend people and refer people to come to Wells Legacy Health and Wellness for healthcare services. Thank you so much for the encouragement, just for your support, for sharing and telling someone to join the lives each and every Wednesday that we're here. I'm so appreciative. Tonight, we're going to jump into another topic. Last week, I discussed and we talked about the brain, right? And brain health. I had to think about it. The brain and brain health, what it looks like in terms of dementia and the different types of Alzheimer's, brain injuries, traumatic brain injuries, things of that nature. Well, the month of June, there's so many different health topics that I want to highlight. We're still going to be highlighting some of the things related to the brain, and I'll be posting some different reels and information on the page for you. Tonight, we're going to jump into a topic that I find is still very important and one that needs to be highlighted more so than anything. And it's men's health. June is also Men's Health Month. And when we speak on the brain and mental health, which we discuss mostly in the month of May, mental health, well, in June, men's mental health is also highlighted, as well as men's health. So tonight we're going to spend some time going over some topics related to men's health. So I want you to pause right now. If you or someone that you know, a male in your life, needs to hear this information, go get them, tag them, send them a message, share this live with them tonight. Share this information, encourage them to come and listen, because they need to hear this information. The men in our lives are so important. And I highlighted this in May when we were speaking on men's mental health and how mental health impacts them. Tonight, we're going to be talking about their physical health, their sexual health, their emotional health, all of the things related to men's health. We only have 30 minutes, so I can't go into all of the topics. However, if there's something that you need information on that I don't discuss on one of the lives, feel free to DM me. Feel free to email us and tag us on the questions online so that we can tap in and answer those questions. We are on all the social media platforms. We're on Twitter. We're on, I think it's X now. I'm not on there too much, but we do have a page. We're on TikTok. We're on YouTube, Instagram, Facebook. You name it, we're there. So if you don't catch us live on one platform, you can catch us on demand on another. So let's dive into it tonight. As I mentioned, we're going to be discussing men's health. And one thing that I know about men and men that I take care of, there are some men, and I'm not going to say all men, there are some men who do not go to the doctors for anything. They could have a hand hanging off and they're not going to go to the doctor. They're not going to go and get the health care that they need because many different factors. And one of the things that I found out is that they're busy working, trying to provide for their families. They're busy trying to make sure that everybody is safe and secure. And just like I mentioned about our women, you can't pour from an empty cup. And there's a phrase that I came across that really stuck with me. Our cup shouldn't be empty at all. And if they are, then we're not doing something right. We're doing it wrong because our cup should never be empty. But when it comes to men, I want to raise awareness to encourage men to, one, take charge of their health, and two, to make sure that they're going to get those recommended screenings and that they're following up with their healthcare providers on an annual basis at minimum. Why is it so important? Why is it so important for men to take control of their health? We are seeing numbers that are astronomical when it comes to men's health. Men die on average 5 years earlier than women, according to the Centers for Disease Control, the CDC. Men tend to skip their health screenings, which causes delay in care, and they avoid mental health conversations. We talked about that. And we discussed some of the reasons why this is the case. But when it comes to men, we want to highlight some things. And tonight I'm going to highlight a few key health conditions and health concerns that I found to be most prevalent in men. And one of them is heart disease. It's the number one cause of death for men in the United States. Some of the risk factors that lead to heart disease: one is hypertension. And as we know, hypertension is a silent killer. Hypertension usually does not present with major signs and symptoms until it's too late, until the impact of those major organs have been done, until the damage has already been done, is when many individuals will notice, okay, hey, something is going on. And even then, and I've seen it, men, women alike, walking around with blood pressures 180s over 120s, and they have no symptoms. Their body has kind of adapted to that blood pressure. And our bodies are very unique and ingenious, meaning they can adapt, and our bodies can do some amazing things, and it will overcompensate for certain things. When one thing is out of balance, it'll overcompensate to try and fix the issue in and of itself. And then high cholesterol, smoking, obesity, sedentary lifestyle are some of the risk factors that lead to heart disease. When we speak of health screenings, when should we start getting our blood pressures checked as men and women? We're focusing on the men tonight. When they're at the age of 18, we should be really paying attention to blood pressure. However, when we're taking kids to the doctors, little boys, babies, to the doctors, blood pressures are being taken with each assessment that they receive based on their age. And so there is an early history of blood pressure monitoring in these individuals. And so if we begin to see elevated blood pressure, which we have in younger men or males, in younger males or young boys, then it's something to kind of put us on high alert that we need to pay attention to. But starting at 18, we definitely need to be paying attention to their blood pressure. But now, going back even earlier If we're seeing a trend where the blood pressure is elevated, we need to be paying attention to it earlier. And we are seeing younger and younger males with high blood pressure and high cholesterol. And so if you have a family history of any of these things, then your screening should begin a lot earlier than someone who does not. So when we're looking at hypertension, high blood pressure, heart disease, lifestyle modifications can help. Exercise, diet, resting, ways to deal with stress can definitely help when it comes to heart disease in men. But one, knowing your numbers, knowing your blood pressure, knowing what your cholesterol, the good cholesterol, the LDL, the HDL, the total cholesterol, your triglycerides, knowing what those numbers are and knowing what they mean and how you can impact them in terms of turning things around. Because many times we can turn those numbers around. It does take discipline. And as I mentioned before, motivation waxes and wanes. It comes and goes, but discipline remains and is what's going to get those individuals through to get the blood pressure and the cholesterol levels into normal ranges. So knowing your numbers is definitely important. Medication. Sometimes individuals will have to go on medication to help control their blood pressure and their cholesterol levels if lifestyle changes are not implemented in time, or they're not effective, or individuals have resistant hypertension, meaning we've done all the things that we can do naturally, the diet, the exercise, we've changed all the things, and the blood pressure is still not adapting or adjusting the way that we should. It should be a decrease in that blood pressure. However, if we're not seeing that, then we may have to put that individual on medication. And sometimes it's for long term. Sometimes it can be just a short term thing until we can figure out what's going on and get things under control. Same holds true with cholesterol. If that individual has changed their diet, they're exercising, and regardless of what happens, their cholesterol levels are still elevated. And typically we see this in individuals who have a family history of resistant hypercholesterolemia or elevated cholesterol. And so we might have to put that individual on medication. Anything that we as healthcare providers talk to a patient about is a recommendation, and it is solely left up to that patient to make a decision on what treatment route they want to take or what regimen they want to start. And as a healthcare provider, when I'm talking to a male patient, I'm talking to them as if they were my brother, my uncle, my dad, my grandma, my grandfather, because I want them to know that their health is serious, not just to them, but to also to me. It's important to me as well as a healthcare provider. And so when we are looking at other health conditions that impact men, we talk about different types of cancers. There's prostate cancer, there's colorectal cancer, and then testicular cancer. When we're speaking of prostate cancer, 1 in 8 men will be diagnosed with prostate cancer in the United States this year alone. And so for screening, when it comes to prostate screening, when we should be having these screenings for men, or when men should be having these screenings, if you are high risk, meaning you have a family history of prostate cancer, then your screening age should be at age 45, depending on your background, genetics, and things of that nature, and family history. The standard for starting the screening for prostate cancer is 50, and it's with a simple blood test. It's a PSA, and it looks for prostate antigen, right? And so we're looking to see if those levels are elevated. If they are, then we need to do some additional testing, the digital rectal exam, to manually check the prostate to make sure that there's no enlargement, there's no polyps or anything like that. And so when we're speaking of high risk, you either have a family history or you are a Black man. So Black men and those who have a family history should start their screening for prostate cancer at the age of 45. And those are the individuals that we consider high risk. For colorectal cancer, which is cancer of the colon or the colorectal system, it starts at the age of 45. And typically the gold standard for colorectal screening is a colonoscopy. Are there different tests that can be done that can screen for colon cancer? Of course there are. You have the IFOBT, which is a little stool kit that you get from your healthcare provider's office or from the lab. You take a sample of your stool and you put it on that card. You send it back into the doctor's office or to the lab. They put some drops on it. And what that does is it looks for the presence of blood. It looks for the presence of blood. Then you also have the Cologuard testing, which actually looks for the DNA of cancer cells within the stool. However, the gold standard is the colonoscopy, and that's where there's visualization of the colon and all of the organs that are included in the colorectal area, and it's looking for the presence of polyps, any abnormalities, anything that could be indicative of a cancer or that will put an individual at high risk for cancer. So while the other tests are great, the gold standard is the colonoscopy. So if you are a male and you are at age 45 and you have not had your colonoscopy yet, get it done. Get it scheduled. We're in June. Get it scheduled, right? Because we want to make sure that we're healthy and that we are proactive and not reactive when it comes to our healthcare. And that's what happens a lot of time, especially when healthcare screenings or recommended screenings are not performed in a timely manner. We are chasing the issue now and trying to manage a potential diagnosis that could have been prevented had we looked at getting the screenings earlier. Another type of cancer that we look at when it comes to men is testicular cancer. And it's most common in men between the ages of 15 and 35. So just like women, we do our monthly breast self-exams. Men should also be doing their monthly self-exams. It's recommended for those individuals in the high-risk group, ages 15 to 35, especially if those individuals are smokers, they chew tobacco, things of that nature. And with the introduction of vaping and the increase in smoking of marijuana and things of that nature, we're seeing an increase in numbers of different types of cancer, not just for men, but for individuals in general, especially lung conditions because of all of the things that are being inhaled. Another condition that we want to talk about as it relates to men is diabetes. 14.9% of men in the United States have been diagnosed or undiagnosed diabetes. Let me repeat that. 14.9% of the men in the United States have been diagnosed or undiagnosed, have diagnosed or undiagnosed diabetes. 14.9%. Undiagnosed means we have individuals who are walking around in our community right now, fathers, brothers, cousins, uncles, grandparents, granddads, who are walking around with diabetes. They have A1Cs that are greater than 6.5 or greater, and they don't know it. And some of the risk factors for this includes excessive weight, inactivity, and poor diet, which is what we're seeing a lot of. And if we can get individuals to be more diligent about their diet and exercise, then we'll begin to see these numbers decrease. And so it's so important that as men, you are exercising, you are eating a healthy diet, eating all the colors, right? I say we eat the rainbow of colors when it comes to food, and that you are getting the screenings. A simple A1C check, which is a single prick of the finger, or when they're running your blood work, your healthcare provider can order a A1C, which looks at a 3-month average of your blood sugars, and it comes up with a calculation, and it gives us a number. Anything 6.5 and greater is a diagnosis for diabetes. And so we want to make sure that we are paying attention to that and that we're getting screened. So it's either the A1C or fasting glucose starting at the age of 35 or earlier if there's risk factors. However, many healthcare providers, even on 18-year-olds, because of the history that we're seeing now, they may order A1C earlier, or if there's a family history of diabetes, then that might be ordered earlier. But it all depends on your healthcare provider and your health history and any signs and symptoms that you are exhibiting, or if you're explaining certain things like excessive thirst, excessive urination, and excessive hunger are all signs of diabetes. And so if an individual is relaying information that they may have one or more of these symptoms or other things may be going on, then we will definitely get them screened for diabetes earlier than age 35. So what are some of the treatments for diabetes? Of course, diet, exercise, blood sugar monitoring. We're seeing more and more people with the continuous blood glucose monitoring devices because many individuals are on medication for weight loss, things that can also be used to treat diabetes. And because we're becoming more proactive when it comes to our health and we're being more involved when it comes to our health, we're doing things that we can track and monitor certain things that we can have control over by our diet and exercise. And of course, there are certain medications that are used to treat diabetes. And anytime that I have a patient that we are trending upward in their A1C, we've already started having those conversations early on when we've noticed that they were starting to increase, that medication might be the way to go. And so right now we're seeing a lot of individuals who are taking the semaglutide and then the tirzepatide, the Wegovy and all of those things for weight loss, but it can also impact the A1C and overall health for those individuals. So knowing what your numbers are is so important. Next thing I want to talk about when it comes to men's health is men's health and the physical impact, mental health and the physical impact on it. As I mentioned previously, men are 4 times more likely to die by suicide than women. 4 times more likely to die by suicide than women. Depression is also often underdiagnosed or misdiagnosed in men just because of their signs and symptoms and their lack of, how do I say this? I don't want to say that they're lying, but they tend to mask their symptoms. Or if they're feeling one thing, they'll say it's something else. So many times men will say that they're tired versus saying that they're depressed. Mental health can manifest in many different ways when it comes to men, and that's fatigue, anger, substance abuse, or physical pain. And so if a man is having a headache and constant migraines, they may not attribute it to depression. If they are sleeping a lot because they're tired, they may not contribute it to depression and mental health issues. When we do all the other tests, everything comes out normal. Then we start asking those probing questions. We find out this individual is dealing with some depression or anxiety, and it's exhibiting itself in a physical form within their body. So what are some of the conditions that we see when it's most common to men in regards to their mental health? We see depression, anxiety, post-traumatic stress disorder, substance use disorder, and they can all have impacts on their physical health. We see an increase in heart disease when men are under a lot of stress. They're dealing with depression and they're not as open about it. The blood pressure is elevated. Their immune systems begin to, kind of get weakened and things of that nature. Stress can impact the body in so many different ways that we don't even understand. We think that we're getting sick because we've been around someone who's been cold. No, you're getting sick because your body is worn down. You're mentally worn down and your immune system is impacted by that. And it is so important that as men, you be able to be in tune with your body and understand when something is not right and when something is off. And typically those who you love, those who you are closest to, they begin to notice those symptoms before you do. And so what are some of the treatment options? We have therapy. It can be talk therapy. It can be CBT therapy. Medications, of course, can be helpful. Support groups, and then exercising. Also, things that you can do to relieve stress. Find a hobby or something that you do outside of work that will help you to release stress so that you're not balling it up and keeping it inside and it's beginning to impact your overall health. Normalize, and I think in May, I said that it is okay to not be okay. And a lot of men feel that they always have to be strong. They can't show emotion. They can't let anyone in on when they're having a bad day because society has put it out there for so long that men have to be strong. Men don't cry. Men don't show emotions. I'm so grateful for those men who are emotional, who show their emotions, men who do cry, men who do talk about their mental health and the impact that it's having on them, and those who are strong enough to go and get help. It takes strength to be vulnerable and put yourself out there and let someone know, hey, I'm not okay and I need to get help. And for those of us who are surrounding these men, let's make sure that we're providing a safe space for them, a place where they can come and talk about the issues and their concerns that they're dealing with. One other health topic that I want to talk about is erectile dysfunction. Many men are walking around right now. As a matter of fact, 30 million men in the United States are impacted by erectile dysfunction. And it's often linked to cardiovascular disease, diabetes, stress, or side effects of medication. And so when an individual has high blood pressure or cardiovascular disease, the blood is not flowing in the proper areas that it needs to in order to have certain body functions occur. And so individuals with diabetes, stress can impact the ability for men to achieve and to sustain an erection. And I know certain medications, such as some diabetes medication and some other medications, can have an impact on a man's ability to obtain or sustain an erection. And if that's the case, then we may need to look at additional medication. But the key is to get the blood pressure under control, get all of the other things under control, and then we begin to see improvement in certain areas. So what are some of the treatments for erectile dysfunction? We have oral medications such as Viagra or Cialis, and then there's some others that have come on the market here as of late that can also help. And then there are some other medications that can be used for erectile dysfunction that are not branded for erectile dysfunction. Looking at the hormone levels to see if that's a cause as well. If the testosterone levels are low, things of that nature, that can definitely be impacting that man's ability to, achieve an erection. Other things, lifestyle changes, diet and exercise. Many times if we have an individual who is overweight, they're kind of living more of a sedentary lifestyle and they have high blood pressure, high cholesterol, and all these other things, then we know that changing their diet, changing and increasing their exercise will begin to decrease the weight, decrease the blood pressure, decrease the cholesterol levels, which then in turn, they'll begin to see some positive impacts in their overall health. And then counseling, it may be a psychological or a mental thing going on or an emotional thing that's occurring that's causing this individual to have these issues with erectile dysfunction. So it's important to find the root cause of it before we start throwing medications at it, right? We want to figure out what's going on so that we can deal with the cause and make sure that we're understanding what's causing it and knowing what other solutions are available. Other things such as vacuum pumps and implants in severe cases can help. Again, if a man is dealing with any of these issues, they can definitely reach out to their healthcare provider and or go and see a urologist or functional medicine provider who can order some lab results. And one of the other things is the low testosterone levels. As men age, their levels begin to drop, just as with women with their estrogen and progesterone levels and their testosterone levels begin to drop, and it impacts sexual health. It impacts mood. It impacts the ability for an individual to gain muscle mass and to lose weight. We begin to see things kind of reverse. Whereas the individual was, very lean and healthy, had a lot of muscle, as these levels begin to decrease, there's a low energy. They don't have the energy to work out, decrease in libido, and then changes in the mood, with all impact sexual functioning and mental health. And so we hear a lot about women and menopause. Well, men go through something called andropause, and that is when their levels begin to decrease. You've heard the midlife crisis, right? It looks different for men and women. And so when we're looking at low testosterone levels, there is a such thing as testosterone replacement therapy. We offer that at Wells Legacy Health and Wellness. So if you are dealing with that and you need an evaluation, please reach out. Let's get you in and get you evaluated and get some blood work ordered so we can see what's going on. What happens is it improves the health, overall health, when we begin to get those levels back up to a normal or optimal level. So it helps with stress reduction, it helps with sleep, and then in turn, it increases libido. Some of the other things that we need to discuss in regards to men's health is sexually transmitted infections and reproductive health. Men often avoid getting treated and testing when it comes to potential STIs or sexually transmitted infections. So we want to encourage regular sexual transmitted disease and STI screening, especially for sexually active men under 30. And in this case, any man who is sexually active, who is not with one partner, that you guys have not been tested and you know that both are negative for all the things, or you have multiple partners and you are having unprotected sex. We want to make sure that we're encouraging the use of condoms, encourage communication and regular exams. I have seen an increase in men coming in or calling and inquiring about just getting routine screening just because they want to get screened. And I'm in the background cheering for them like, yay, go you, because you want to know your status. Not because they're involved in anything risky. They just want to know what their status is and understanding that there is options available when it comes to treating. And if you're in a relationship or if you are dating multiple people and you want to make sure that you are safe, healthy, then reach out. So I've talked about a bunch of things tonight and I've kind of gone a little over, which I hardly ever do, but I feel like there's some things that are really important to discuss when it comes to men's health. We want to talk a little bit about recommended ages for screening. So at the age of 18, blood pressure, STI testing, mental health check, and testicular cancer testing or screening. Again, as I mentioned earlier, for individuals who've had a family history or who are at high risk, we start these screenings a lot earlier. And as kids are little, we start checking their blood pressure. And I say the importance of this is my nephew was 17 when he had a heart attack and blood pressure was through the roof, and his blood pressure had been elevated since he was very young. So it's important that when you go to your healthcare provider that they're screening even as young as, they are elementary school, right? Toddlers even. We want to make sure that we're checking their vital signs, making sure everything is trending in the right way. And at the age of between 18 and 29, we want to make sure that they are doing their testicular self-exams. And between 30 and 39, which again, right now, we're ordering these blood work earlier, not just at between ages of 30 and 39. Skin checks. You want to make sure that you're doing a skin check. We recommend yearly dermatology exams or visits and skin tweak when you go to your healthcare provider for your physical exam. They should be asking you to take off your clothes so they can look at your back, so they kind of look at your skin. They should be putting a stethoscope on you. They should be palpating and feeling your belly. They should be listening to your lungs and all the things, and your ears, your eyes, looking in your mouth, checking all the things to make sure that everything is okay. And then between the ages of 40 and 49, having the discussion about prostate exams, diabetes, mental health, colorectal cancer, if they are at risk. And again, we know that Black men are at risk and are at a higher risk for certain things than others. And then prostate screening, colonoscopies, bone density, if they're at risk, and then hearing and vision exams, which should be done yearly, especially if an individual has diabetes or if they already have any issues with that. I want to encourage you to talk to your primary care provider about getting your annual wellness exams. We perform annual wellness exams here at Wells Legacy Health and Wellness. So if you've never had one, book an appointment with us so you can come get a thorough, detailed exam and make sure that you get the personalized care that you need. I want you to have those open conversations about mental health and sexual health with your partners and with your healthcare providers. With me, there's nothing off limits. My patients come in, especially the young ones, bless their heart. We have conversation and they're looking at me like, is she really talking to me about this? Yes, we're going to talk about all the things, right? I just want to make sure that the men in our lives are taken care of. As we are coming up on Father's Day this Saturday or this Sunday, happy Father's Day to all of the fathers, those who stand in the place of fathers, who are father figures to those that you didn't necessarily aren't genetically bound to, but you stepped in and you took that role of a father. Happy Father's Day to you. And what more an important time to discuss men's health as we're coming up on Father's Day. So I just want to take a moment and say happy Father's Day to all of the fathers, father figures, what have you, the aunts, the uncles, the stepdads, the godfathers, the fathers, the granddads, all of those who have been placed in a position to where you can make an impact on the life of someone else. And you're standing in the place of an absent father. I just say thank you. Thank you so much, and happy Father's Day to all of you. Again, if you need assistance with getting health care, if you have not had a physical exam recently, if you're having any signs and symptoms, or if you have any questions, reach out to us. Wells Legacy Health and Wellness, we're here ready to service you in all of your healthcare needs. Until next time, stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. My call to action to you is, if you have not scheduled your annual physical exam, schedule it today. Stay safe and be well. Take care. Bye.